Hey guys, welcome back to the First Methodist Shreveport podcast. I'm here with Jordan Scroggs, the Executive Director at MLK Health Center and Pharmacy in Shreveport, Louisiana.
Yeah, thank you so much for having me. I'm really
Yeah.
excited to chat today.
Glad you're here. So could you tell us a little bit about you and how you got here?
Yeah, so like you said, my name's Jordan Scroggs, from Alexandria, but for the most part have been raised in Shreveport. Went to Byrd High School, went to Centenary College, and then like most young people who are from Shreveport, wanted to spread my wings. Moved off to Austin, Texas.
Oh, really?
And when I left, I was pretty sure I was never coming back to Shreveport. And then about 3 or 4 years into Austin, I realized that Shreveport had this pool that was bringing me back. I moved back to Shreveport. My whole family's here.
Nice.
And believe it or not, one of the first people I reached out to when I came back was my predecessor, Janet Minasani, who was the former executive director at MLK. I had done a school project when I was at Centenary on the marketing from MLK, and got to know the mission, got to know the people and the patients, and always really respected the work that they were doing. And during my time in Austin, MLK had moved from a temporary location to our permanent home on Olive Street. And so I reached out to Janet and just said, can I come by and take a tour and see the new facility?
Yeah.
And she was like, well, it just so happens we're looking for a marketing person.
All right.
We'd love to have some side work with you, doing some consult work. And then one day out of the blue, she sent me a message and she said, have you ever thought about being an executive director? It's like, well, now that you mention it, I suppose maybe, yeah. Why do you ask? And she was someone that was incredibly thoughtful about her retirement plan, that she wanted to retire on her own terms, and she wanted to do so early enough that she could still travel and go and see and do all the things that she wanted to do. But she wanted to make sure that she had a 3 or 4 year runway with her retirement so that she could properly train her replacement, so that there was a very smooth transition for the organization. So back in, 2017, I joined the team. Started out as the marketing coordinator and then moved up to the associate director. And then in 2021, I stepped into the role of executive director.
Goodness, that is quite the story.
It is. It's really amazing how all of these pieces came back into play, and I'm really happy with where I've landed.
Cool. So what brought you to Austin? Was it just work or wanted to go somewhere different?
Just wanted to go somewhere different. And it was one of those places that it was far enough away from home that I was, had my freedom and my space, but I could still hop in the car and get back home.
Yeah.
Because like I said, my whole family's here. I've got siblings and wanted to be very present with graduations and birthdays. And so it was that perfect distance.
Yeah.
And Austin was a young, fun, vibrant city, so I did that. But like I said, it was about 3 years in, and I swear I heard the Lord say, it's time for you to go back home. And I remember I was in my bed, and I was like, wait, what? No, not me. I've made my peace with Shreveport and loving my life here. But he was like, no, you need to go back home. And you have to be obedient when you hear the Lord speak. So
Absolutely.
yeah.
I love that. And so that's great just because being from Texas, I can appreciate Austin at that period of time, because you said it was 2016?
Well, 2016 is when I moved home, so I moved 2013.
Oh, yeah.
So
you had peak Austin experience.
Yes.
It was before it was a hype train, before everybody knew about how great it was. So
yeah, I was kind of on the tail end of that. I remember moved there and was not used to traffic, right?
Yeah.
So traffic, from 3 to 7 is rush hour. And then my first visit back home after being in Austin, I was stressed out about, I got to get on the road. Am I going to make it? I'm going to miss my deadline to where I was going. And I hopped on at 4:45 in Shreveport, and there was no one. Y'all, I thought I got left behind in the rapture. I was like, where are all the people? And then I remembered it was Shreveport. And we don't have 2 million people a day coming in and out of the city. So
yeah. Shreveport traffic is if you're stuck for more than 5 minutes, you feel like it's just the end of the world.
Yeah. So definitely got some perspective.
So what was it like coming back to Shreveport?
Well, see, no, that's where the timing really looked out for me. Is when I moved back is when Shreveport, it seemed that there were a number of people coming back to Shreveport who were fresh with ideas and excitement and investment in Shreveport. So it was definitely different than Austin, obviously.
Yeah.
But it was fun and exciting because we were getting coffee shops. You know, Shreveport was starting to invest in their downtown, and these festivals that we now know and love, like Crawfest and Prize Fest, and these things that make Shreveport cool were really just starting to be birthed at that time.
Yeah.
So it was exciting to come back home.
Nice.
Yeah.
And so, like, from the marketing perspective, like, was that what you studied at sitting there, was marketing? Or
No, political science.
Oh, all right.
Yeah, I wanted to work for the State Department.
Okay.
Really had a passion for foreign relations.
Yeah.
And then through centenary, I got to do what's called the Washington semester. So I got to go and study a semester at American University and got a really great internship and realized that the culture of D.C. was just not the way that I wanted to impact change.
Yeah.
And so I came back, and that was my junior year, so I had 3 semesters left to graduate. And and I was someone that I knew what I was going to do. I knew who I was going to be. And you come back with 3 semesters and that entire life plan that you've been working on really since high school, wanting to make sure I got my scholarships to get into a good college. I had no idea what I was going to do.
Yeah.
Kind of paralyzed. And I had a professor who was on the board at was on the board at MLK and was doing a project with the marketing. He was like, well, you should just come join this project. And I was like, well, number one, I'm terrified of needles. All things healthcare freak me out. I have no idea what I can bring to the table, but I've got nothing to lose, right? I have no idea what I'm going to do with my life. And that's when I found this beautiful intersection because my dad got hurt when I was young, and he didn't have health insurance. And so I grew up in a home where, you know, my parents didn't have health insurance, and my dad had a chronic illness, and the impact that has on the entire family unit. And I remember I was interviewing some of the patients, trying to understand really that heartbeat of MLK. And there was a particular gentleman that was talking, and he started saying things that were exactly like word for word phrases that I had heard my dad saying growing up, just about the desperation and the hopelessness of being unwell and thinking that there's no one that cares, that there's no one there to help. Because health is so foundational, right? If you're not healthy, it's hard to work well, it's hard to love well, it's hard to be active and involved in your family life and your church life and your community life. And so to have people who had no idea who I was or what I've been through, to hear words played back to me that I'd heard in my home, to just realize how deep this need is, and to realize it's kind of weird I don't know how to say it, and I'm getting a little tongue-tied here, but not that I never didn't believe my dad, but when someone's chronically ill, sometimes it sounds like a broken record, right? Because they're not getting the help, and so they're just kind of stuck on this loop, and you know, you hear the same thing over and over, and you kind of, well, you know, you kind of get tired of hearing it, and then you hear someone outside say it, and you're like, I didn't realize, you know, how deeply their struggle was. I didn't realize how heavy that burden was. And then you meet someone else who's walked a mile in those shoes, and you realize, like, oh wow, this is really deep. And if only I had known that there was a place like MLK that could have helped my dad, because that's the thing about MLK. We've been around for 40 years, but most people have no idea who we are. And I don't know why that is. You know, it's kind of like, oh, we're Shreveport's best kept secret, but I don't want us to be, right? Because there are so many people out there who don't have access to health insurance but are sick, and they're desperate, and they need that help, and there's a place desperate to help them. We've just got to figure out how to connect people to what we're doing.
Yeah, I love that, because we've talked to people like Krista from Hope Connections, and she did a great job of communicating exactly what you said. Like, there are people who are working who might have a chronic health condition, but they're not able to afford insurance. And so eventually they get to a point where they're not able to work because that, you know, chronic illness is, you know, making it so that they can't work. And then they become hopeless or become homeless and it's just like a vicious cycle of not having health care or some sort of health insurance can do, or
Absolutely.
put people in a situation like that. So, and I love what you said about when you're close to someone who has a chronic health condition, it's very easy to hear it day in and day out and just
Become
look
numb
at it.
to it.
Yeah.
Right?
And you're just like, well, I mean, it can't be that bad. Like, you're just a complainer. That's what your problem is.
Right?
But then,
Right.
like you said, perspective of hearing it from other people and like probably being more in tune to what their pain is at the MLK Health Center. That's
Absolutely.
powerful.
Absolutely.
And so you get to Shreveport, you find the MLK Health Center,
I do.
and you are asked to, after a while, you're asked to be executive director or like be put on that path.
So that email came pretty quickly after. So I worked for a firm in Austin that was a digital design agency, and so I was able to work remotely. So I was still working from my Austin firm here in Shreveport.
Ah, okay.
So it worked out very beautifully there.
Yeah.
And then, so Janet asked me to do some contract work on the side. And then probably within 2 or 3 weeks of that first meeting is when it was literally, "Hi, Jordan, have you ever thought about being executive director? Send." I was like, okay. Yeah, it was just, completely caught me off guard. And I said, well, yeah, I mean, that definitely sounds like something I'd be interested in career-wise.
Mm-hmm.
So she took me to dinner, and that's when she said, I want to retire in, 3 to 4 years, and I want to do it the right way.
Yeah.
I want to do it well, because you can't properly hand over an institution to someone, an outsider, in 3 months. You really need that runway to understand the history, the legacy, the relationships, why why things run the way that they do, why these partnerships matter, and that's just something that comes with time.
So what does an executive director do?
So I manage the entire organization. So I primarily focus on the fundraising, the donor relations, and then I support my team as we build out policies and programs. That's one of the things that I try really hard, that I'm not the boots on the ground. I'm the ones making sure that my boots on the ground have all of the resources and the support that they need to do their job well.
Okay.
And so we have a team of 11 paid staff, and then we have a team of 15 to 20 volunteer providers and nurses, nurse practitioners. And then we also have partnerships with the med school, the nursing school, LSUS, LSU School of Allied Health.
Okay.
So I manage all of those relationships and those programs to make sure that my team are able to do their job well.
Awesome. So do you ever see yourself doing that, or no?
No, I was going to be in D.C.
Oh, yeah, I forgot about that.
It was so funny. I went back to Centenary and did a panel before COVID, and they were, I forgot what the question was, but I mean, I was the kid freshman in college walking around with my briefcase, right? Because you dress for the job you wanted, right? I wanted to go to D.C., so I had my briefcase. I didn't have a backpack. And I found the briefcase in my closet, and I was like, goodness gracious, needed to relax a little bit. But that was the plan. So
good.
Yeah.
Glad God brought you here.
Absolutely.
And so what does MLK Health Center and Pharmacy do?
Yep. So we are a free clinic and a free pharmacy, and we work with adults who fall in the insurance gap. So they make too much money to qualify for Medicaid, but they can't afford private insurance. And so for us, that's about 300% of the federal poverty line. And so for a family of 4, that's about $6,900 a month before taxes, income-wise. And in that gap, they don't qualify for the tax credit for the marketplace. So truly, they're without options when it comes to their health care. And we work exclusively with adults that have chronic diseases. So they have diabetes, hypertension, cholesterol issues, asthma, COPD. So people who, in order to stay well and to stay on the job, they need regular access to a provider and their medications. And if it wasn't for MLK, they would wind up in the emergency department for their primary care.
Which is exponentially more expensive.
And it's not what it's designed to do, right? So you walk out of the emergency department and they never think of you again because they're immediately addressing the next person coming in.
Yeah.
And so it's a Band-Aid well, Taylor Swift is a Band-Aid on a bullet hole, right?
Yeah.
So it's not really fixing the problem. It's addressing
Yeah.
the immediate issue, but that
Mhm.
chronic disease is not being managed properly.
Yeah.
And that's not to fault the emergency department. That's just not what they're designed to do.
Mhm.
And that's actually how MLK came to be. So we were founded by Dr. Robert Jackson and Sister Margaret McCaffrey, who was the founder of Christian Services, which is still around today. But Dr. Jackson, born and raised in Shreveport, knew he wanted to go to med school. And he'll tell you himself that he, like me, wanted to get out of Shreveport. But LSU Med was the only place he got in. So he found himself stuck in Shreveport, but he buckled down and eventually became chief resident of internal medicine at LSU. Wow. And he was doing his ER rotation, and that's when he was seeing people come in to the emergency department because they needed a blood pressure medication. They had run out of their insulin. Or this was the third or fourth time he's seen that person, and they've now had a stroke because they couldn't get their blood pressure medicine. And he couldn't figure out, well, why are you coming to the emergency department? Like, why are you not going to your primary care provider? And that's when he started simply asking questions of people in his waiting room at the emergency department. And that's when he discovered that population, that they made too much but not enough, right? That unfortunate gap. And so he went to Sister Margaret at Christian Services, hoping that he could really maybe just pass it on to the sister. Like, here's this problem. Here's these people that need help. You help people. You know, here's you a new problem to take under your umbrella. And Sister Margaret said, well, I'm not going to do this. We're going to do it together. And she sat him down at her dining room table at the soup kitchen that she ran that day. Yeah. And Dr. Jackson saw 2 or 3 patients. And he came back every Saturday. In the first couple of months, it was only 2 or 3 patients. And then when that community, which was at the time Ledbetter Heights, because we started on Sprague Street right behind the church.
Oh, really?
Yeah, our building still stands on Sprague Street.
Huh.
And Christian Services was right across the street with the soup kitchen. And after about 3 months of him consistently coming, that community realized that Dr. Jackson was serious about wanting to help them. That clinic immediately went to 30 patients every Saturday.
Wow.
Yeah, every Saturday. And then that was when he discovered a new problem. So people were coming, he was seeing them, diagnosing them, writing them a prescription, and then they're coming back in 30 days for their checkup, and nothing had changed. Their blood pressure wasn't getting better, their glucose wasn't getting better, and he realized, well, they can't afford the prescriptions that I'm writing them. Which was then the question of, well, why am I doing this? No one's getting better. Like, no one's becoming more healthy.
Yeah. Like, it's just diagnosing the problem, but there's no solution.
Exactly. So he starts scrounging through supply closets at the emergency department for pharmaceutical samples, calling up people who had private practices that he knew, trying to see if they had any free samples. And after about 3 years of piecemealing everything together at the soup kitchen, it became apparent that there was a lasting need for his services, and that the soup kitchen was just not the proper place to run a clinic. So Christian Services donated the land across the street, and we built our own building, filed our own 501c3. But Dr. Jackson was adamant that if we're going to really do this, we have got to get a pharmacy component, because again, no one's going to get healthier without it. So our founders went down to Baton Rouge, and they lobbied for the first free and charitable pharmacy license.
Wow. Like,
so,
first in America or first in...
First in Louisiana.
Okay.
Yeah, so we have the oldest free pharmacy in the state of Louisiana.
Wow.
I'm very proud of that. But that allows us to provide that one-stop shop for our patients. So when they come for an appointment, excuse me.
Okay.
Sorry, I thought I was going to sneeze. They get to see their provider, and our providers volunteer their time. And we work really hard to make sure that our patients are seeing the same provider every time they come. So they're building that relationship with their provider. They're not having to tell that story over and over. The provider knows their history, not just their medical history, their family history, where they work. Because we know the big phrase now is the social determinants of health, but we've believed in that for a long time, that where our patients live, where they work, where they play, all of that impacts their health outcomes. And so really wanting to make sure that everything we do is rooted in relationship, MLK. So they come and see their provider, and we have a lab on site, so they're getting their blood work done.
Oh, wow.
We have a dietitian on staff, so they're getting that nutrition counseling, because with chronic disease, food matters. Food matters, period, but especially when you have a chronic disease.
Yeah.
We do diabetes education. We have specialists that can come. We do women's health, but then we have the pharmacy on site. So they leave with their medications as part of that visit.
Wow.
And everything is at no cost to our patients.
That's incredible.
No cost.
And so MLK Health Center is a nonprofit, right?
Mm-hmm.
Oh, yeah, 501c3.
Yeah.
So how was all of this grown over time? Because it sounds like that's quite an undertaking to go from like having just a plot of land donated, building a building, and then now like a full-blown, almost not mini hospital, but...
Yeah, so, I mean, you ask our founder, Dr. Jackson, and the board, or anyone, it was really my predecessor, Janet Mentasani. So Janet came on 2003, 2004, and part of her interview process was, we have $30,000 in the bank, and we have no guarantee that we can keep you on more than 6 months.
Gosh.
And she was someone who loved a challenge and believed in what was being done and knew how important it was that people had this access. And she just bear down and did the work, and we started getting prescription assistance programs. It's called PAP. So those are medications that come directly from pharmaceutical companies. So that allowed us to really expand our pharmacy program.
Yeah.
She started developing partnerships with the med school, and then really a big one was the NSU College of Nursing. So that would have been 2006, 2007, where I think 2006 is when we started with the diabetes clinic. And so we developed a partnership with their graduate program. So the RNs who were going on to become nurse practitioners, we set it up so they could get clinical hours at MLK.
Okay.
And so part of that was we built a contract with the faculty at NSU. So their nurse practitioner faculty began running clinics at MLK.
Wow.
So now I think we have 6 clinics that are run by NSU faculty members. So that has greatly expanded our ability to provide care.
When you say a clinic, what is that? When someone runs a clinic?
So when they run a clinic, so it's that provider, it's their patients. So a clinic is when they're coming to see their doctor, they're getting their lab work, they're getting their education and their pharmacy.
Okay.
And a clinic being it's that doctor's clinic, because we don't have clinic every day. Because we have to work around our providers' hospital schedules, their private practice schedules, or their teaching. So, like today, we had a diabetes clinic. So those patients that came were all diabetic, and they were coming to see their provider.
That's interesting.
Does that make sense?
Yeah. So, like every day of the week, it could be like a different doctor's office, basically. Like Monday, the building could be for heart patients. Tuesday, the building could be for diabetes patients. Wednesday, it could be just like a primary care.
Yeah, in framework, yes. So we have a diabetic clinic, but if someone missed their appointment today, then they would get filled in with another provider on Saturday.
Okay.
So there's a lot of fluidity in it, but a clinic is just when we have a doctor in the building seeing their patients.
I see.
Yeah. But we do try to do it grouped along chronic disease. So we can really tailor the education that we're doing in the waiting room. And we also do our best to schedule patients in cohorts. So like the patients that were there today, they all had the exact same return date. And they will continue to have the same return date. So they're coming as a group. So when we do education with them, we have much better participation because they're not in a room full of strangers. These are people they've been coming to the doctor with together for the past X amount of years.
Wow.
And it creates a built-in accountability, right? Because they're coming to see their friends as much as they're coming to see their provider.
Yeah.
Because, again, that relationship is at the root of what we do. Yeah, so that's really important to what we do, is trying to make sure that we have cohorts, and those cohorts are always seeing the same providers.
I love that. Just the idea of having people in a room together, or like they're almost doing this journey together.
Absolutely. And that's really
great.
important, for any chronic disease, but really with diabetes, because that is such a lifestyle change and it's
Mm-hmm.
hard. And you make progress and you get 2 steps forward, and then the holidays hit and you feel like you've got knocked 3 steps back, and
Mm-hmm.
there's no fix to it, right? It is
Yeah.
a lifestyle. It is a lifetime journey. And to be in the company of people who are in that boat with you, who are,
Mm-hmm.
you know, hitting the same challenges but then finding their own solutions. And we'll see patients in their waiting room. Oh, well, I tried this. Oh, well, I tried that and I found that really worked. And so
Mm-hmm.
they're building in that support mechanism
Yeah.
in the waiting room while they're also getting all these other services. So
Goodness, that's amazing.
it's important.
Mm-hmm. So, what have you learned most at being at MLK Health Center?
Oh, man. And that's a big question. I've learned so much.
Because you said you studied it a little bit whenever you were at
Mm-hmm.
Centenary, and then so I guess was there like a drastic change when you came back after Austin?
Say that one more time.
Like you were there at
Mm-hmm.
whenever you studied at Centenary,
Mm-hmm.
and then so was it like a foundationally different or fundamentally
Sorry,
different
yes,
place?
I'm tracking
or-
with you now.
Okay.
So, I always knew I wanted to do work with a purpose, right? A mission-oriented work. And then when I was in Austin, I was working for a for-profit firm, and they did great work, and they had values and things that are respected, but it was still about how do we make money to grow the company, and for me, I just wasn't cut out for that. Like the mission wasn't there for me. And so when I came back and had the opportunity with MLK, there's a daily purpose to what I do. There is a daily purpose to what my team does, and I try to always remind my team how blessed we are that we get to get up every day and say that the work that we do matters. The work
Yeah.
that we do changes people's lives, and I believe the work that we do saves people's lives.
Mm-hmm.
Now, it's not in the emergency department like reviving someone, but if you have diabetes and it's unmanaged for long enough, you don't survive that.
Yeah. Mm-hmm.
So to be able to come alongside people and help them hit these victories, hit these milestones, learn how to manage their disease. I think for us, one of the greatest victories in our job is when someone comes to us, they've been struggling, we get them, situated with their medications, we give them tools to take care of themselves, they start to feel better, right? Because they're like, oh, I felt one way for so long that I thought that was normal, but now that I'm getting better, this is what I'm supposed to feel like, right? And then they
Yeah.
start doing better on the job
Yeah.
because they're not having these diabetic episodes. Then they get promoted, and then they get insurance for their family, and we hate to see our patients go, but when it's because we've taken such good care of them and they've done the work, and they're getting recognized at work for that, getting promoted and getting insurance,
Yeah.
those are moments that make us really proud.
I'm sure.
Mm-hmm.
And so, how do y'all get providers? Like, are y'all still looking for providers?
We are
or-
always looking for providers, especially so now that the state of emergency is in it with COVID, they're doing the Medicaid disenrollment process. So people who had been on Medicaid throughout the pandemic, Medicaid was not enforcing eligibility because they didn't want people to lose coverage and not be able to stay well during the pandemic. Well, now they're starting to reinforce eligibility, and all of that is to say, I think by this time next year, like over 200,000 Louisianians are going to lose their Medicaid, so they're going to be
Wow.
without health insurance. Now, some of those people are eligible for Medicaid, they've just not submitted their paperwork, but there are going to be several thousands, potentially 100,000 people who are going to lose their Medicaid because they're no longer eligible, and they're going to need a place to go.
Yeah.
And so we're expecting our patient load to increase by 15-20% over the next year.
Goodness.
So as clinic grows, we need providers to help. So the answer is yes. We are looking for MDs, nurse practitioners, and we're looking for RNs and phlebotomists that can help us draw labs. So
Okay.
yeah.
And so, how do y'all find those people?
A lot of it is word of mouth. Providers are recruiting. That's a big one. And then, honestly, the last couple of providers we've had is they were students going through one of those programs at their institutions, have become licensed, and now they want to come back with their license and practice by giving back.
Oh, wow.
So,
That's
but
great.
word of mouth, opportunities like this to get the word out.
Absolutely.
Yeah.
And so, is it mostly volunteer time for doctors, or?
Yeah, so
Okay.
all of the providers are volunteer.
Okay.
So we have the staff that run the day-to-day. So about a couple of things to know. So we do have our own medical malpractice. So we provide that to the providers at no cost. So they're covered anytime they're with us. We do paper charts.
Okay.
Old school, because providers, every hospital has their own proprietary electronic medical record system or doctor's office. Nobody wants to learn another one.
Yeah.
So it's old school paper chart. We do all the legwork. Our providers love to come because they actually get to practice medicine. Because we're not filing insurance. We're not knocking on the door every 10 minutes like, hey, you've got to get 15 patients in the hour to get your billables. If you need 30 minutes with a patient, you have 30 minutes with the patient.
Yeah. And could you talk a little bit more about that? Because I'm not sure most people know, like, the ins and outs of, like, how a doctor's time is structured whenever insurance is involved.
So I'm not the expert on that,
Okay.
right? Because we don't do that.
Me
but so, Medicaid has different bill back rates. So and I haven't done the research recently, so I'm sure there's going to be one of your providers in your congregation like, that's not right. But I think it's like a 40%. So like whatever the bill was, like Medicaid only pays like 40% of what that total cost is. It's probably less now. So in order for a provider to hit the number of billable hours that they need to be able to run their practice, they've got to see higher volume of patients because they're not getting 100% of their bill. They're only getting a portion of it.
I see.
And in Louisiana, we have so many people on Medicaid. Like, that's just we have a lot of people that depend on that. So that's the patient base, right, are people with Medicaid. And so in order to make sure that people in our community have access to care, they're having to see more and more to be able to keep their lights on, to be able to pay their staff. And that puts a lot of pressure on providers to have to see 10, 15 patients in an hour to make sure you hit your numbers.
Yeah.
And that there's so many impact on that. The impact on the providers, who get into medicine because they want to help people. And then you have the person in front of you and you're not really getting to build that connection because you got to get to the next person. And so our providers like coming to us because they actually get to take a minute and they get to connect with their patient. They get to know their patient's story. And they get to spend that time to really practice medicine with the patient.
I'm sure that helps because it makes a vast difference from someone like coming in. You can tell they're frazzled. They've got to be somewhere in 10 minutes or just telling you what you need to know and then they're gone, as opposed to someone who knows your situation and is willing to actually listen if you have any feedback to say or any sort of objections, and then they're able to help them understand what they're supposed to do but also why they're supposed to do it.
Absolutely. And the relationship is so important too because unless you've been medically trained, I mean, medicine is so overwhelming for the patient, right? And so if the doctor says, well, you do what the doctor says, but then that medication's not working for you, or that plan that was put in place is not really going to set you up for success, but I don't feel like, honestly, I don't feel like I'm smart enough to challenge the doctor, or I'm not comfortable enough to say, hey, that sounds great, but an example to make this more realistic. So we have a number of our new patients. They are newly diagnosed diabetics, but many of our workers are they're roofers, right? And so, and we also, many of them they're not documented, so they're not getting, they don't have access to certain medication programs that we could offer to others. And so we've come up with a plan based on, okay, this is the medications that we have available for them. And of these options, this is the best one for that patient. And that would be an insulin regimen where they're injecting themselves 4 times a day, right? And so if we didn't have a team where the relationship's built in, we could, prescribe that to a roofer, and that roofer's not going to be able to do that, right? Because they can't come down 3 or 4 times a day to measure out their insulin, to take their lunch, to do the injection, to check their blood sugar before and after. And if you don't have the relationship when they come back, you would think that that patient was just non-compliant, right? That their
Yeah.
numbers are not getting better because they're just not doing what they're supposed to.
Mm-hmm.
Well, they're not doing what they're supposed to because they were never able to do it in the first place.
Yeah.
And so when you have that relationship, you know that they're a roofer, right? You know what their day-to-day looks like. It's like, okay, well, that was the best option, but that's not an option that's going to set them up for success. So this is the next best thing, but they're going to be more compliant with this. So at the end of the day,
Yeah.
this is the better path for them.
Mm-hmm.
And then the next patient comes in, and you start from scratch, right? Because what worked for that person might not work for this person. But you got to have the time to be able to know the patient and then make those decisions. And it's really hard to do that when you're in a well, I want to stop what I'm saying because I don't want to project. Because providers, what our doctors and what our nurses are going through in the health system with the demand and just on the sheer need, the health need in our community, and then the pressures in their health system. But within our clinic, we work really hard to protect the patient-provider time so that we can make sure that we're not setting our patients up for failure by putting them on a therapy that's just not going to be successful for them.
Yeah.
So,
That makes sense.
yeah.
And so I'm assuming you've enjoyed everything you've done with MLK Health Center.
I have. It has
Good.
been, and one of the things too is I have the most exceptional team. So the people that I manage, I've worked in different environments, and there's always a couple people that really love their job, and then there's always a person or two that are there just to get a paycheck, and people in between. But the team that I lead, and I'm not just saying this, my team, every single person there believes in our mission. They show up to work because they believe in what we're doing, and they care deeply about our patients. Sometimes a little too much, right? Like they care more about the patient's health than the patient does, and they get frustrated because, you can't make people do, change that they're not ready to make.
Yeah. That's got to be hard.
So it's just an incredible blessing to lead people who care so much about our community and take their job very seriously.
Yeah.
Yeah.
Has there been like a transformational, obviously not like a major transformational shift in the community, but have you noticed like a difference in the community that MLK has affected? Like I know you said in the beginning, like the beginning wasn't really trusted, and then like almost once the recognition of the community trust was there, it really exploded.
There's been a couple of, I'd say maybe transitions. So in 2015, 2016, somewhere around that time, Medicaid expanded. So a lot of our patients received coverage that allowed them to have access to more than just primary care. So we did see an exodus of some patients, but in 2020, so like during COVID, I'm not saying that that COVID caused it, but during the pandemic, our patient population went from about 30% Hispanic to 60% Hispanic, so it doubled in size. We had just been serving that population, and again, had built that trust, and so they started telling their friends, and so we started recruiting patients that way, and so that patient population has grown, and within that growth, we've seen a lot new diabetic cases coming up, and so really important that they're getting the care that they need, because again, it's a lifelong journey, and if people do not have their medications, they're just not gonna live well with their diabetes. So.
Nice. And so do y'all have any projects that are coming up for MLK Health Center?
I don't know if a project per se, but we have a garden on site.
Okay.
Yeah. It's a garden that produces year-round because like I said, food is medicine, and we don't want to just tell patients to eat healthier. We want to show them how to do that.
Yeah.
So we have the garden on site, and then we have, I say chefs, but I say that loosely, people who love to cook and, like to do that in front of people. We have chefs, cooks come in a couple times a month and do cooking demonstrations for our patients. And we try to do it based on either what's growing in the garden or what's a seasonal produce to reintroduce, cooking seasonally. Because a lot of people don't cook anymore, right? They're taking out, they're going through fast food. So teaching people to cook and shop seasonally, and showing patients that eating healthy, it can only take 5 minutes, a couple ingredients, and it actually tastes pretty good.
Mm-hmm.
And so if they like the recipe, then we can go out to the garden and either harvest the exact ingredients or a supplement ingredient so that they can go home and try to recreate the recipe without having to spend any of their money first. Because a lot of our patients have children. And in this economy, I mean, everyone's strapped when they go into the grocery store. You're going to keep going to that frozen food section because you know your kids are going to eat the chicken nuggets. And you've only got $20 and you got to make it go as far as it can.
Yeah.
There's not a lot of freedom to explore new recipes. And so we try to do that for them, allow them to recreate it at no cost with the hope that if they can do it and their kids or their family like it, then they'll go to the grocery store and invest their own money into healthier produce options. So we have a garden on site, and we always need help in the garden.
Okay.
So if you have a green thumb, it doesn't have to be the greenest thumb, but if you have some interest of being outside in the garden, we're always looking for volunteers. If you enjoy cooking and have a little bit of a background and kind of walking through people how to prepare a recipe, I would love to talk to you.
Okay.
Obviously, if you have any sort of medical license, I'd love to talk to you. But those are kind of the big buckets that we need support around right now.
Nice.
Yeah.
And how has First Methodist impacted MLK Health Center?
First Methodist has been a long-time financial supporter, both at the institutional level. The First Methodist women, or the Methodist United Women, have always been a supporter, and then individual congregants have been supportive. You've played a really big role in our diabetes program, making sure that we have the tools and the resources to properly educate patients on what diabetes is, what's happening to their bodies, and then just chronic care disease management. So like the big umbrella has always supported making sure that the people who need help have access to help and that our doors stay open. Very important. Very important.
Nice. Well, thank you, First Methodist family, for sure.
Of course. Absolutely. We couldn't do this work without supporters like you individually and then First Methodist as a whole. You have truly been a partner in health, and you're putting medicine on mission every day.
I love it. Man, well, thank you so much for being here, Jordan.
My pleasure. My pleasure. Thank you.
All right, guys. We will talk to y'all next time.